morning. Y'all may have noticed that there's a common HUD uniform today that John and I both have on. Same tie and same suit. First of all, I want to begin just by giving a huge thank you to John and everyone at our Office of Lead Hazard Control in Healthy Homes. I know that so many of the folks in this room have worked with our office over the years. Many of y'all have gotten grant funding to do fantastic work in your own communities. Let's give them a big hand for the work that they do. Thank you, John. You know, it's great to see so many experts, policymakers and advocates in the same room focused on what truly is a national challenge. You know, just a quick glance at the agenda and the speakers tell you that there's a lot of potential for new and strong momentum on this issue. I'm more confident than ever that we can achieve the goal of ending lead poisoning in the United States. I want to take a special moment to give a shout out to Ruth Ann. Let's give her a round of applause. And she is a child. Yeah, I've known Ruth Ann for a few years now, and first of all, she's like the Energizer Bunny. So much energy, she keeps going and going, and her and the organization and the partnerships that she's built have made a big difference in the lives of so many folks. I want to give them my thanks as somebody who has worked with them over the last 2.5 years. I also want to give a huge thanks to Healthy Babies, Bright Futures. Where are they at? All right, thank y'all. To the Icahn School of Medicine at Mount Sinai, right here. And the National Center for Healthy Housing, right here. And all of them, all of the partners who helped put this together. So, as y'all know, these days at HUD, we call ourselves the Department of Opportunity, because we believe that housing is a powerful platform to spark greater opportunity in people's lives. But I think in our own lives, we know that it doesn't matter how much opportunity you have in front of you if you don't have your health. Health is essential to be able to take advantage of that opportunity in full. And that's why the work that the folks in this room do is so vitally important to the overall mission of HUD and our federal government, and not just the government, but the idea of America, a place of unlimited opportunity. You help make that possible for so many young people and adults throughout the country, and I want to thank you for that. By committing ourselves to this cause, we've undertaken an urgent and a critical challenge. I know that many of you are familiar with the basics of the lead problem, but they bear quickly repeating. As you know, according to the CDC, children are exposed to high levels of lead in at least 4 million homes through dust, paint chips, or even soil. We know that over 500,000 children, about 545,000 in these homes, have unsafe levels of lead in their bloodstream. We know that the science is clear, that there's no safe level of lead in children. Plus, lead exposure usually goes undetected and occurs with no obvious symptoms. Only complete elimination of lead in American homes can solve this problem. And the damage caused by lead to young minds and bodies is insidious. In the bloodstream, it can damage red blood cells. It interferes with absorption of calcium needed for strong bones and teeth, muscles, nerve, and blood vessel functions. In turn, these can cause nervous system damage, speech and language problems, developmental delays, and even seizures and unconsciousness. Problems that stunt the development of far too many children and can condemn them to a life of poor health. Most tragic of all, these problems are preventable. We know how to prevent lead contamination in homes, and there's no shortage of workable solutions. In fact, our only shortage is the lack of will to end this problem once and for all. These are more than enough reasons why this summit and our commitment are so important. That's why we're here today. HUD is here for the simple reason that every child in our nation deserves a safe and healthy place to live. No matter how much money their parents make or don't make, no matter what zip code they're growing up in. As the President has said many times, where you grow up should not determine where you end up. In October, our department observed the 25th anniversary of the creation of the Office of Lead Hazard Control in Healthy Homes. The office was founded in 1991 when George H.W. Bush was president and the late Jack Kemp was HUD secretary. Since then, HUD has awarded more than $1.58 billion in grants to communities to identify and control lead-based paint hazards. This has helped protect nearly 200,000 low-income families across 45 states from multiple hazards, not just lead contamination. And we've used our enforcement powers to remove lead from another 180,000 homes over that time. Earlier this year, we announced nearly $100 million in lead hazard control grant funding, as well as over $10 million in Healthy Homes supplement funding to the lead hazard control awardees. We estimate that these grants will reduce lead-based paint hazards in more than 5,600 low-income homes around our nation. In public housing, HUD has long required routine lead paint inspections. And the impact of these and other efforts were documented in a joint CDC-HUD study published in the American Journal of Public Health in September. That study found that children living in HUD-supported housing have about 20% lower blood lead levels on average than children in low-income families living in homes where there is no federal assistance. That shows the progress that hard work can accomplish, and I want to thank so many of you for that. To help expand that progress, this spring we rolled out HUD's Healthy Homes app, which is downloadable by anyone via Apple iTunes and Google Play. In clear language, it enables users to quickly understand potential hazards in their own homes and take simple steps to fix them. One of its major components will connect these residents with early education, with nutrition programs, counseling, and tutoring to combat the impacts of lead exposure. It can also enable housing advocates to help these residents report potential violations of our lead safety regulations. But we also know that that's not nearly enough. And that's why we're renewing our focus on advocacy and on assessment. For example, we've partnered with other federal agencies and local governments to address lead hazards in communities like Flint, Michigan, and East Chicago, Indiana. In both cases, we acted decisively to assess the contamination problems and protect the families living in those conditions. Although many of you have been dedicated for years to ending lead poisoning, it sometimes takes a dramatic event like the Flint water contamination scandal to wake up the public and, frankly, Congress to what's needed. That traumatic event at least had the positive result of renewed efforts in Congress, in state and local governments, among philanthropies, to ensure that all homes are lead-free and safe for children. This summer, at HUD, after months of intense work at all levels of the department, we released our Lead Safe Homes, Lead-Free Kids Toolkit. This comprehensive action plan for both immediate actions and a long-term vision to eliminate lead in homes, including a clearinghouse of information for HUD-assisted residents about lead hazards, safety, and their rights, is now in place. As part of this plan, we've strengthened our collaboration with other agencies and with the private sector, including the Green and Healthy Homes Initiative. And we've been improving HUD's process for identifying lead hazards to enable parents to learn about their children's exposure and obtain care more easily and more quickly. For example, During Children's Health Month this year, the DC government hosted a bilingual education and blood testing event at Mary's Center Daycare in Northeast DC. An even more far-reaching advance of this action plan is the forthcoming release of HUD's final rule that lowers the actionable threshold for blood levels in children to the CDC's current range value of 5 micrograms per deciliter of lead. The HUD threshold has been 20 micrograms, as you all know, for the past 17 years. But the argument for adopting the CDC standard has been very compelling. This new threshold will trigger an earlier response when a child under 6 years of age is exposed to lead-based paint hazards in HUD-assisted housing. The new rule includes prevention efforts, but also requires specific actions if health screening finds an elevated blood lead level. For example, these include that within 15 days of learning the child's condition, owners or operators must complete an environmental investigation of the child's home and common areas. Within 30 days, if lead-based paint is the source, interim control measures must be taken to control that hazard. And similar measures must be taken if the nearby units housing other children have lead-based paint hazards. In short, by aligning our standard with a science-based one used by the CDC, we can act more quickly and forcefully to make certain that the homes we support, the families that we support, aren't the source of injury to the children living there. This proposed rule is the centerpiece of HUD's intensified effort to protect our next generation of Americans from this insidious poison. I saw Maya Rupert in the audience, who helped spearhead our efforts to coordinate this. Let's give Maya a round of applause for her great work. I'm really excited about moving forward with the entire panoply of actions that we've taken. Also excited about the advocacy that's happening in Congress for more resources. And yet, all of us know that there's still much more work to be done. The lead, dust, and soil discovered at the public housing complex in East Chicago was a wake-up call for the American public. HUD went all out to secure vouchers for the hundreds of residents to move to safer housing. And my sincere hope is that Congress will take seriously the threat to thousands of American families across our nation who are at similar risk, like the families in East Chicago. That should include setting aside dedicated funding for a meaningful response to a lead hazard problem that is undoubtedly much more widespread than we now know. I'm also proud of the progress we've made in reducing health hazards in HUD-assisted homes in the past several years, and that this summit signals a stronger momentum for accomplishing the goal to end lead poisoning within 5 years. Whatever uncertainties there are about future federal leadership in preventing lead poisoning, including lead hazard control grants, I believe that your enduring commitment will produce even more progress in the years to come. And here's why. First, advocacy groups are stronger and more active than ever, keeping this issue before the public and pushing everyone to do better. I'm especially pleased with the work of the summit team to convene stakeholders like you and to strengthen our capacity for decisive action. It makes a difference. Because of such broad support for action on lead hazards, it remains a nonpartisan issue, not politicized, at every level of government, in which just about everyone is willing to take action. Our grantees have been creative in collaborating with local governments, community leaders, and residents to solve lead problems. I'm especially impressed by the greater coordination among local and state health, housing, and environmental agencies. We've also made important advances in the technical understanding of the problems and solutions. Research by organizations like the National Center for Healthy Housing continues to expand our capacity to address not just lead, but all health hazards in American homes, including how those hazards interact with each other. Further, property owners and trade organizations like the National Association of Home Builders, The National Multifamily Housing Council and National Apartment Association have been collaborating constructively to solve health hazard problems. For example, their participation in our proposed lead-based paint rulemaking resulted in stronger, more cost-effective solutions. And finally, the ultimate stakeholders, the residents of HUD-assisted housing, have stepped up their efforts to protect their own children. In cities like Cleveland and Chicago, they've campaigned successfully for community-wide solutions, supported in both cities by law school clinics and other nonprofits that have provided strategic help. In closing, let me leave you with this final thought. You all have the necessary ingredients for success in this room. Strong and able local, state, and federal leadership, the professional competence for cost-effective action, a commitment to ridding our homes of lead poisons, and advocates ready to tackle the daunting challenges ahead. All of that adds up to enormous potential in this country for ending childhood lead poisoning within 5 years. I know, as you do, that that's ambitious. I also know that there's a tremendous amount of ability and passion and intelligence and resourcefulness in this room and in so many rooms that can make a difference. We also know that the stakes are very high, but the possibilities are as well. I know that you're up to the challenge. Let's go meet it. Thank you very much.